So we are going to start our instruction course on the Smart Eye Clinic. Basically, it's based on how ophthalmologists can use their smartphone in their daily practice to take images, to calculate their IOL power or do a measurement of the visual acuity or any of those things, and how all our instruments can be used for patient counseling. So initially we have Dr. Prasanna Venkatesh Ramesh for his 3D 4D resident fellow pedagogy.
I would like to start off with a demo in my smartphone. Yeah, I'll try to stick to the time and finish it off quickly. So this is, can you see the slides here? This is now my smartphone so this is a benefit of the videographer. Is the video on? Video is on, superb. So this is my phone that you can see. So this is the recent app called the IMG Max that we have done. So for the benefit of the viewers, I just wanted to do the demonstration here. You can see that this is one of the first apps in ophthalmology where I'm using my finger here. You can see me on the stage moving the face. This is subtractive learning, my dear friends. In textbooks, you don't get subtractive learning. You can actually remove structures where you can see me now removing the skin. Now I'm touching the skull and removing it. Meninges, brainstem, brain. You can selectively remove structures and then you can rotate, go into the structures in whichever frame that you want to. And this is something that we want to give the neophytes so that they don't have any blind spot. We have added so many layers. If you want only the nucleus, the nerve and the extraocular muscles, you can have only those layers and you can study only those layers. So this is subtractive learning at its maximum. So the same thing in AR mode with good lighting, you scan the environment. You can see that my fellow colleagues Dr. John and Dr. Hirika are also there in the background. The same concept with a good lighting, you can also have it in augmented reality. So which I'm finding it difficult to do, but this is, my dear friends, you can see this will not give any blind spot to the user or the pedagogue, where he can go into the eye and have a good evaluation or good idea of what the sub concept is. So yes, some of this which you'll all be knowing is the Iron Man, who first started using the holograms. And was it science fiction? No, it's a science-based reality. We have done a patent for this, and these are the six innovations or the journey that I would quickly touch upon in a single minute on each. So initially it was always animations. Me being a glaucoma person, you can see the iris process and the peripheral anterior synechiae on the right. So I started making animations like this and then took my residents or the neophytes into real-time scenarios. So this is the iris process, which is fine and arborized. This is more broad basal, where the IOP will get increased. And this is why do we do a pupillary blockers. The block happens here, the aqueous is not able to go through like this, so it pushes and the effect happens here. So simple concepts. Why do we do a YAG PI, and what is glaucoma in a single minute? So for me, if I have a moving image or a video, I felt the concepts were much better highlighted. This is a single minute video, my dear friends, where you can see the increased vertical cupping. So the 6 or 7 points in glaucomatous damage, like you can see, then I zoom it in more, having the glaucomatous cup with an inferior notch, then slightly zooming in and showing the non-specific bionetting sign. Then the basic sciences of inferior is slightly lesser than superior. The ISNT rule is breached in this patient, then showing the RNFL, so that is the structural defect. Then in the same patient, the visual field is brought on top and the corresponding superior arcuate scotoma is shown, followed by the OCT of the same patient. Transparency is reduced, the inferior RNFL defect and the ganglion cell layer defect is noted. So this is how we started our animation journey. The channel is there. Currently we have around 1600 subscribers. The channel goes under my name, and we have made a lot of animation videos. ALPA, argon laser peripheral iridoplasty, how does it happen? So these are things that we don't need to mug up. In cataract, simple cataract extraction, how the iris falls back, how the ciliary body falls back after lens extraction because of the iris plateau diaphragm shifting backwards, how the scleral spurs falls back, how there is a breakage of peripheral anterior synechiae. So the more we started making animations, the more we felt that we need to make the unanimations, which was the second part of our particular thing. And we started making the models, template, the eyeball, the circle of Willis. We started making it digitally in the third dimension, and we launched an app with buttons. So this was the first prototype which we launched in the Android platform with the buttons. So we didn't know how to go with AR, so we thought we'll have a buttons. The user can click the buttons and go into any frame of choice. This is a dynamic app. It flows dynamically without, just not like a book. Vitreous on and off, silicone oil. And you can see that you can also use filters, like you can have the fundus with different pathologies that you start seeing in a OPD with color fundus, autofluorescence, infrared and whatnot. So this is the deck that you can start collecting multitude of patients. You can just keep on adding, and then we launched the Windows version. So that was the innovation 2.1 of the same. Moving on to the third was the augmented reality. Today, if you have an Android phone, for the people who are looking in this video in YouTube, you can go to App Store, or rather this is an Android where you have to go to Google Play Store and click EYEMGAR. AR is for augmented reality. And you can see this is my friend here, also my research and team partner, Mr. Aji. He is demonstrating the holograms in the smartphone of an Android phone. You just need a Nokia 7.0, which is available in every smartphones today. So he's demonstrating how in real time an optometrist, a paramedical, a first year postgraduate, or any neophyte can see the retina for what it is, can see the iris or the angle for what it is. And this is again the smartphone video of the same, explaining complex structures of the angles, as well as you can see the splinter hemorrhage, RNFL defect, and the any cases you can have, any views you can have. That brings us to the fourth innovation, innovation 4, which we are currently working on very aggressively with simulators, EMR as well, where my fellow on the right, he seems to be moving through thin space, but he's actually seeing the patient's anterior chamber angle. He's using his hand tracker to actually expand through it, examining the fundus and so on. Even if you have an anterior segment imaging tool, you can have your own OCT filter. This really helps in training for hydrodissection versus hydrodelination when there is a posterior polar component. You can customize training. The kids nowadays, this is my daughter, she's very well oriented with this technology. I feel this will be the future where we'll have to train, we'll have to just bring these products into the market so that the next generation will have a much better time by learning through these kind of pedagogical tools. So then we also had this 3D printed circle of Willis, cavernous sinus. This was just an additive of reality that we wanted to add with the feedback we got from the senior teachers and so on. And the last one is the touch, which I demonstrated the first. This was a recent innovation where we had a 3D view and an AR view. We wanted to give the user the freedom of subtraction. So this is again a very, very important one, I felt, because we want to have only selective structures seen. Let the user decide what structure he wants to on and what structure he wants to off. So by doing that, we give the user a complete freedom on choosing the structures, and the virtual dissection is also possible just with the fingers in this particular app. So, and this is in 3 dimensions too. I call it maybe the pseudo 4D. I learned this word yesterday actually. It's more like a 3.5 version or a pseudo 4D, where it's technically where you use your finger. That's where you can see that you can use your fingers, move into it. And this is the brain that you can see on the right. We have a brain model which is completely anatomically read, and this is a very well scientifically proved and validated model. 3 models have been available in the app now: a brain, an eyeball, as well as the whole neuroanatomical artery, venous and nervous complex. So these are 3 available. We have also done a simulator, a smartphone simulator. In your phone, you just need to open this. Yeah, I'm completing in 30 seconds. So you take your phone into the pupil, just like how you take your direct ophthalmoscope forward, you can go as a simulator. So this, how it helps is left hand, right hand, ambidextrity. In the initial stages, we all use only one hand to see the fundus. So can we use both the hands the day one itself and use it, and then also for e-counseling? So that was a part of these kind of innovations. and we do have a good amount of downloads. We have around more than 1000 downloads in Android, and this is one particular app that is picking up very well, which was recently launched with more than, again, 700 to 800 downloads. So this is the metaverse that we have created, and our software is a translational software, not an imaging one. In 60 seconds it gives you the holograms, and we all serve the community to a large extent, be it the medical fraternity community, our peers, or the students, or even for the patients. I think this will serve as one of a new cutting edge tools, and with that I would like to acknowledge my team. It's a team effort always, and this is the QR code for the viewers who are seeing this. If you have missed my previous slides, this is the QR code. You can have all the 6 innovations today. You can go home, or whenever you are seeing at the comfort, do download these innovations, utilize it, give your feedback. That is how we can make the next innovation possible, because each innovation was the feedback that was given by the previous innovation, with which we developed the other innovation. So I would want more feedbacks so that we all can innovate, keep innovating more. So most of it are published. Also, you can read it, except the last one, which is not yet published, the IMG Max. And thank you, Kerala, for having me, Prithvi, with the Kerala flavor. So I did have some of the good images in the proceedings book as well. So we are a moving image department, and I hope you loved these images, as these images as well. The iris, the one on the beach, and the other things. So we work a lot of images, and once again, thank you, Prithvi. Thank you to one of the persons I really look up to is, again, John sir, and also the young brigade, Hirika. So with that, I also thank the audiences on a Saturday morning. 2-3 people are here. You made us not talk alone, and thank you for being here. It means a lot. Thank you.
Thank you, Dr. Prasanna, for that innovation talk on 4D sorry, augmented reality metaverse. We know that the metaverse is here because everything is now going digital. It's 4G, 5G, 3D, 4D, 5D, and everything, including all the businesses, are now taking up this. Facebook has become Meta. All the physical businesses are now looking for a space in the virtual space so that they can enter into our daily lives, and then all this is going to be augmented by artificial intelligence and all these virtual reality things. Next, we have yet another innovator, Dr. Prithvi Chandrakanth. He is going to he is going to talk about his innovations, the ASPI, the IOL scope. These are innovations which are frugal innovations which can be used by each and every one of us when we go back to our ophthalmology clinics. Over to you, Dr. Prithvi.
Thank you.
And I would like to say that Prithvi is a mentor for many students, especially in Arvind Coimbatore, Arvind Pondicherry, and in every conference he goes to, he has so many innovations. The reason why the Indian Journal of Ophthalmology has an innovation section is Dr. Prithvi. He had put so many innovations there that they said, okay, we need a new section for this, and they had started the section, put an editorial and all that for that. So let's just start the session now. So I'm going to talk about the smartphone apps for ophthalmologists, which can be used for all these assessments of the eye, calculations, 3D imaging, and so on. I'm Dr. John Davis Akkara, Western Eye Hospital, Kochi, and also in Chaitanya Eye Hospital, Kochi. So financial interest, I have made some of the apps mentioned in this, but they are free. You can download them from the Play Store for free. So practically no financial interest, but they are made by myself. Okay. So there are many apps for ophthalmologists. If you just search for ophthalmology on the Play Store or App Store, you get so many apps. I'm going to point out a few useful apps which you can use in your everyday practice. So let's see, there are so many apps for reading and for journals and information. We won't go into that. There are patient testing apps. So patient testing apps would mean that there are tests for visual acuity and things like that. There are calculators, patient education apps. Then, as I said, ophthalmologist education and reference apps, ebooks. I won't go into these things. Let's go into the patient testing apps first. So first, let's know what can be tested. Visual acuity can be tested, both distance and near. Then there is contrast sensitivity, color vision, And of course, for pediatric cases, you can have pediatric optotypes on your smartphone, fixation targets, and also if you want to do a duochrome test to correct the refraction correctly, you can do that. And just going over the list once, then you have all these things: astigmatism, fan, optokinetic drum, and so on. Now, specifically, let's go to the apps themselves. I would say if you have to choose one app, that is the iHandbook app. This is an app which is available both on Android as well as the iPhone. You can just download it, and mostly you will be using the calculator part and the testing part. Just a pro tip: when you install the app, this is an ad supported app, so every time you open it you might get an ad loading, and then you have to wait for it to load and then skip. If you are in a hurry or just suddenly check somebody's color vision, you just turn off your internet mobile data, the ad will just skip immediately. You can just skip the ad immediately and start testing. Okay, just a pro tip for this. And in addition to the calculator and testing, you have all the ICD codes and the eye atlas, some symptoms, and you can just show the patient this is what glare looks like, this is what halos look like, things like that. So you have in the testing part, you have amp surrogates, you have multiple amp surrogates. You can just take it and slide and use the different types of amp surrogates there. You have color vision testing, and let me assure you, this color vision test has better color matching than the ones which you might buy for the printed ones which you might buy from the stores here, which are not the original. So those, the colors may not be accurate. This one, the color is actually accurate. Then there is the contrast sensitivity, Pelliropsin, this is a near type. And duochrome test you may not be using. Fluorescent light, it doesn't work. It's just there. For that, you will have to use the innovation which was presented by Hirika and Prithvi, that is the blue filter at the end of your flashlight. That really works. That gives you the ultraviolet light which is needed to give the fluorescence. Then, of course, the near vision cards. And the optokinetic drum is something else which I have used often. You can use that and you can observe the optokinetic nystagmus. I have used it mainly for checking when person says they have no vision. There's a factitious vision loss. Use optokinetic nystagmus drum and you can see the nystagmus. Then the others, pediatric fixation targets, optotypes, and so on. Then I had to just mention that there have been studies which show that these apps may have different sensitivity for detection of color vision deficiency. But let me assure you that I have been using regularly, and it working well. The color vision testing, it's working well. Then we have the IOL calculators. So most of these, they have the SRK2, SRK-T formulas. And if you want the advanced toric calculators, they are also there. They are there from the specific companies as well. And the surgically induced astigmatism calculator is also there. And the corrected IOP calculator. So all these things are available in the IOL calculator is not available in the iHandbook, but these are separate apps available. Surgically induced astigmatism and corrected IOP calculator is there in the iHandbook as well. Then visual acuity converter also is there. Then you have transpositions, which I often use, and the others also can be used, aged bifocal, ad, etc. Of course, these two, as I mentioned, these are also quite useful as a glaucoma specialist. And the cataract grading, you have an LOCS3 app which does not grade it for you, but it shows you the reference images. So if you want reference images for LOCS3 grading, you have it there. Similar with the ETDRS app, ETDRS, you have the reference images. So these are very simple apps, but they give you a standard reference. Then visual acuity, you can also use the iChart Pro. The iChart Pro, it has a connection between an iPhone and an iPad. You keep the iPad at the distance of 6 meters and you control it with the iPhone. So you have a portable visual acuity chart which is digital, which can have multiple languages, which can also have color vision charts. So you can, this is very useful app, especially if you do not have a digital chart with you already. Then color vision sensitivity, you have this Dr. Hue game. This is not really a color vision test, it is a contrast sensitivity test, but yeah, this is a game which will allow you to test that. You have the Farnsworth-Munsell 15Q test as an app. So right now you search for this. Inside that you have this, you have to arrange the colors in order and it gives you the Farnsworth-Munsell score. And you also have the 100Q test, but that is there on the laptop. I actually it is there on iPad as well. Farnsworth-Munsell 100Q test is there on the iPad as well. Then OKN strips is already there in the iHandbook, but you can get a separate one with adjustable width and speeds. Then you have the Parks 3-step test, which just guides you step by step how to do the test. In case you forgot, you studied only for the exam and forgot, you have this app which will guide you. Okay, very simple app. And you can test stereopsis. So stereopsis testing is quite difficult. Without the expensive treatment flight test and the TNO test and all that, you can just use this free app and the red-blue color glasses. These glasses are available for 200 rupees or something. Go to Amazon, search for red-blue color glasses, and you can do the stereopsis test, the TNO test with the red-green color glasses as well, the Armstrong glasses. You can also do it with Google Cardboard with the stereo acuity test. This is for contrast sensitivity, vision C, but it is not required as you have the Pelly Robson already in the handbook. This is also not required, mainly for research purposes. Visual Fields EC is an app which is available on the iPad to test visual fields. Not as accurate as an HFA, there is no eye tracking, but it gives you a very vague measurement of the visual field. Then the OCT browser, in case you have all the slides of the OCT, just copy the folder, you can browse it on your iPad. You can go through all the slices instead of just a single picture. Then this list of apps, medication compliance for the patients, IOL vision simulator, again for the patients, multifocal, monofocal, EDOF, etc. and so on. Then you have learning apps, that is anatomy 3D models, but this is now replaced by Dr. Prasanna's app, the 4D apps, and these are some apps which I have made. I also made the eye grader app. Thank you.
Thank you, Dr. I would like to play Dr. Shishir's video. He has a little bit of a clash of commitments.
So next is Dr. Shishir Verghese. He's going to have a presentation on smartphone-based innovative devices for ocular imaging. Let me just get the audio also fixed.
Smartphone-based devices for ophthalmic imaging. The authors have no financial interest in this presentation. We first introduce you to smartphone-based gonioscopy imaging. Smartphone-based gonioscopy imaging has been described previously. The first technique was to directly image the angle with a smartphone with the patient in supine position. Here the image obtained would be dependent on the maximum magnification possible on the smartphone. The other described technique was using a macro lens attached to an iPhone 11 Pro Max camera to obtain direct and slit images. Grading the angle could be performed with this technique, however, using 2 observers and a relatively expensive film. Dr. Prithvi has already described anterior segment imaging with intraocular lens. We expand this innovation to image the anterior chamber angle. The materials required are a smartphone attached with an intraocular lens and gonia mirrors. A slit lamp and retinoscope are optional if a slit source of light is required for grading the angle. The ideal intraocular lens power for this technique would be 6, 8 or 10 diopter. Any type of gonioscopy mirror could be used. One of the advantages is the patient can be examined in any position without the need for slit lamp. The image is obtained using the video mode of the smartphone with the flash on. The smartphone has to be moved closer to the gonioscopy mirror when an intraocular lens of high power is used, which is shown in these images. The images above are that of a normal anterior chamber angle image using 6, 8 and 10 diopter intraocular lens powers respectively, and the ones below are images obtained using different gonioscopy mirrors. This technique of imaging the anterior chamber angle provides us highly magnified images. Here a normal angle is imaged and magnified. The image below shows a magnified image of the ostium post-trabeculectomy. Additionally, slit images could be obtained, which is useful for grading the angle. A second observer using a retinoscope, which is a slit source of light, is required to obtain slit angle images. A slit lamp can be used for the same purpose as a slit source of light. The main advantages of this technique is good image resolution, its versatility, and its particular use in screening and peripheral centers, as well as for resident education and training. The main disadvantage is it is less maneuverable in smartphones with central cameras. We now describe another innovation, the Trash to Treasure Red Cam, which is an innovative smartphone-based fundus imaging tool. The devices for fundus imaging are mydriatic and non-mydriatic fundus cameras, handheld fundus cameras, and smartphone-based fundus imaging. Smartphone-based fundus imaging was first described by Lord in 2010. It has advanced throughout the years with more specific softwares available. Multiple smartphone-based imaging platforms are available, each having their own advantages and with different fields of view. Few of the available ones are the M2 RedCam, the JAIS RedCam, Welch Allen Examiner, DI, Peak Retina, and Vulcan View RedCam. Dr. John Davis, who is one of our speakers today, has developed the pocket foldable fundoscope using 3D printing. This is a low-cost, ultra-portable smartphone-based fundus camera. It even acts as a case for the 20D lens. The Trash to Treasure Red Cam is a simple, affordable, portable, do-it-yourself smartphone-based fundus imaging device. It is made utilizing common materials like the used hands-on bottle, chart paper, and a universal smartphone adapter. It is designed as shown in this video. The universal adapter is commercially available to purchase. The principle of Trash to Treasure Red Cam is similar to that of indirect ophthalmoscopy, where the observer's eye is replaced by the smartphone camera. The image is acquired using the video mode of the smartphone. The patient can be in supine or sitting position in a dark room. The smartphone camera is focused to obtain an artifact-free image. The recorded image is inverted and laterally reversed. Few camera apps are available to autofocus and obtain good images as well as store patient data. These images show the Trash to Treasure Red Cam in action. These are the fundus images obtained using it. Some practical points to note are that the smartphone flash should be coaxial with the camera, and a magnification of 56 degrees can be obtained with complete mydriasis. The T3 RedCam has been used as an effective tool for diabetic retinopathy screening and has shown to reduce the travel time, cost, as well as prevent loss of income of the patient. The T3 RedCam can be used as a screening tool for diabetic retinopathy, retinopathy of prematurity, glaucoma, pediatric retinal diseases, in emergency medicine and ICUs for capturing fundus images, as well as a teaching tool for postgraduate students. The main advantages of the T3 RedCam are that non-expert examiners can utilize it easily, its affordability and portability, and improving the cost-effectiveness of screening programs. To conclude, both the imaging devices we mentioned are frugal, cost-effective, and can be used for screening, documentation, teaching, and patient education.
So we saw a lot of innovations. That was a presentation by Dr. Shishir Varghese. We saw a lot of innovations which you can use in the smart eye clinic. Now, when all of you go back to your eye clinics, I want you to think about what you can use in your daily practice. Do you have any questions? Anything that you want to try, like from Monday, and you want to know how to set up? Please do ask questions.
Apps for amblyopia?
Yes, sir. So there are a bunch of apps for amblyopia therapy. There are basically two types of apps. One is the apps which will just on the screen, it will give you some game to play, and you try to occlude one eye and play with that. Just search for amblyopia apps. There are a lot of apps. I can't recall any specific one. There's even one by Dr. M.S. Ravindra of Karthik Netralaya, Bangalore, and there are several international apps as well. Then the other type of apps, you have to use the red-blue glasses. Note that it is not a red-green, it is red-blue, easily available on Amazon or whatever, 200 rupees or so. And this will have stereo images. That is, the images will be split into what can be seen with the left eye and right eye, and that will separate out the images, and you can adjust the brightness of each, and then they play a game. They slowly train their weaker eye to improve. So those are the two types of amblyopia therapy apps.
That's the same thing as Binox.
Yes. So Binox and some other companies also here in the stall, they have paid subscriptions for their training. They use the same principle. They use the red-blue glasses and they give amblyopia therapy using that. You have the free versions also available. You have Tetris, you have all these small games, Mobile Snake also available for free right now. So you can try your patients on that first before going on to the paid things.
Is there any way we can test something like teller equity for children?
Teller equity cards, I haven't seen, but it must be.
Very young children.
iHandbook has it now, it seems. Yes, sir.
That can be downloaded.
Yes, ma'am. The iHandbook app, it keeps getting updated. It's made by an Indian based in the US, and it keeps getting updated. There are thousands. I think there are probably 1 million users probably, and teller equity cards are there in it currently. And also, if anybody has an idea for an app, you can just let us know. We can try to get it done.
So, are there any devices for the slit scanning, slit images for the anterior segment? I'm a cornea surgeon, so.
Yes.
Actually, we have devised a slit also. This is a small torch which I have. It's a moon torch, which I can connect to the adapter. So this is the adapter which we have made, and you can actually see the slit. I can show you.
Yes, that will be coming in the next edition of IJO. Yeah. The innovation, look for the Dr. Prithvi Chandrakanth section. It is there.
Thank you.
Thank you, everyone. Thank you for attending our IC.